Hello and welcome to Let's Medicine. Today the topic of discussion is epigastric pain. So what is epigastric pain? It's the pain in the epigastric area. Epigastric area is basically the abdominal surface just beneath the xiphoid process and in between the two sets of ribs just above the umbilicus, as shown in the picture. Well, talking about the history and the most likely diagnosis of epigastric pain. So, if the patient comes with a history of pain that get worse with food, so the probable diagnosis will be gastric ulcer. And if the patient comes with a history of pain that gets better with food, with the food intake, then it's duodenal ulcer. The pain gets worse, then it's gastric ulcer. The pain gets better with food, then it's duodenal ulcer. And if the patient comes with the history of weight loss, then mostly the diagnosis will be cancer or gastric ulcer. If a patient comes with a history of tenderness, then pancreatitis is the probable diagnosis. And if the patient comes with the history of bad taste, cough and hoarse, so the most probable diagnosis will be gastroesophageal reflux disease. If the patient is having a history of diabetes and bloating, so the probable diagnosis is gastroparesis. So what is gastroparesis basically? It's a disorder that slows or stops the movement of food from your stomach to your small intestine. And if the patient comes with no history, so the most probable diagnosis will be non-ulcer dyspepsia. Diagnostic tests. Endoscopy is the only way to know the etiology of epigastric pain because of ulcer disease. While the radiologic and barium studies are not that accurate, treatment plan includes proton pump inhibitors, H2 blockers, liquid antacids, and misoprostol. It's always a good start to give proton pump inhibitors in epigastric pain. H2 blockers like ranitidine, nizatidine, cimetidine, and famotidine, they are not as effective as proton pump inhibitors, but they will work in 70% of the patients. Liquid antacids are roughly of the same efficacy as H2 blockers. Misoprostol was designed to prevent NSAID-induced gastric damage, but when the PPIs arrived, the misoprostol usage became obsolete. Well, that was pretty much it about epigastric pain. Meet you in another video. Thank you for watching.